Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Touro College of Osteopathic Medicine to help you sort through what's going on with COVID-19 in our communities and, of course, across the region. We always want to hear from you. Call us at the number right there at the bottom of your screen, 516-393-1800. All right, New York has suffered its deadliest day yet from the COVID-19 virus, as Governor Cuomo reports more than 700 new deaths. Cuomo says he doesn't believe a single person died in the state because doctors couldn't actually provide the care. He says we are saving everyone we can save. Now, statewide, the death toll now stands at just under 5,500. That's accounting for roughly half of all the deaths in the United States. It's really the epicenter here. The coronavirus has claimed the lives of 500 people. That's Nassau County. Now, Suffolk County executive today described Suffolk's numbers as staggering and taking an enormous emotional toll every day. 263 deaths just in Suffolk. Now, the governor says there are signs we may be reaching a plateau. The number of hospitalizations is slowing. Now, across the state, the number of cases is nearing 140,000. Those are the numbers right there on your screen. Long Island still being hit hard. The Nassau is at more than 16,000 infected. Suffolk, more than 15,000 positive cases. Now, Governor Cuomo said earlier today, antibody testing and tri-state cooperation will be the keys to restarting life when the time comes. He said you have to know who had the virus, who resolved the virus, and who never had it. Several Long Island hospitals are launching experimental trials asking those who recovered to donate their blood plasma. Now, Northwell Health says it's testing all delivering mothers for COVID-19 before they give birth. The health system opened a drive-through that's in Lake Success. That's for pregnant women who have a scheduled delivery at either North Shore University Hospital or LIJ. Expectant moms at other Northwell hospitals are tested when they come in to deliver. Now, there's also a new push to prevent people from heading to the East End to ride out the outbreak. They're calling for Airbnb to cancel all rentals out there. Now, in Southold and Southampton, short-term rentals are allowed but must be a minimum of 14 days. That's the law. Now, we went online, easily found much shorter stays. Southampton town supervisor says anyone renting for a couple of days at a time, they're breaking the law. And President Trump says he will put a hold on U.S. funding to the World Health Organization because he says, quote, they missed the call on the pandemic. All right, let's get right to our discussion. Joining us tonight, Dr. Dean Mitchell, clinical assistant professor at Touro College of Osteopathic Medicine. He specializes in immunology, infectious diseases, and allergies. Thank you, doctor. Thank you for all you're doing right now. Let me start by just asking, how are you doing?
Well, we're all trying to hang in there, as a team. My staff, which has been terrific, we've worked with me for over 25 years in many cases. We're all trying to be there for our patients, allay some of their fears, arrange for testing, and essentially try to get everyone through this crisis.
Now, we're basically the epicenter right now. We're the epicenter of the state, and the state is the epicenter really of the country right now. Is our healthcare system, you're right there in the front lines, is our healthcare system keeping up with this?
Well, they're trying, but as everyone's been seeing on the news, they're working under very difficult circumstances. In so many of the hospitals, I have colleagues and friends of mine that are working tremendously hard and working with, the bare minimum of protective gear, which hopefully is going to improve. So I think it's really just a question of everybody doing their part to get people evaluated, treated, and of course, tested.
Yeah, you really are the heroes, all of you, the warriors in the state, and we appreciate everything you do. I have many more questions, but let me get to the phones real quick. Nixon from Brentwood. Nixon, you there?
Hello, doctor. I wanted to ask, actually, as far as, symptoms I've been facing the last 3 days, have been tasting or smelling, and I wanted to know what should I do at home as far as treating myself.
I'm sorry, Stone, I didn't hear him as clearly. Could you repeat that?
He's self-quarantining, wants to know any type of treatment he can do at home.
And he's asymptomatic, and he's not been sick.
Nixon, you still there? I think we lost Nixon. Nixon,
okay. Well, let me say this, because I think this is a couple of important points to get out there. Everybody right now is essentially self-quarantining because we want to, as Governor Cuomo and all the experts are saying, we have to, quote, flatten this curve. And with the apex, the height of the epidemic happening right now, the best place you could be is in your home and not around other people. There is not the hardest evidence, but again, I'm recommending to my patients some of the recommendations I'm seeing from the Functional Medicine Institute, where people can also take supplements at home, such as high-dose vitamin C. We're talking about 2 to 3 grams a day. Vitamin D3, about 5,000 international units a day. These are all important things that people can do at their home to keep their immune system strong. And so I feel no hesitation in recommending those type of things that could be helpful.
Let me ask you, what about the difference between Tylenol and say, aspirin or Aleve? I know that Aleve, I think, suppresses your immune system a little bit more. Is it much of a difference that we need to worry about that?
Yeah, I think the recommendations at this point, they're concerned that what's called the non-steroidal anti-inflammatories, such as Aleve, ibuprofen, Advil, while they are effective in relieving joint pain and fevers, they may lower your immune system. So they are probably recommending Tylenol, which again, you have to be a little bit careful, because again, very high doses of that can affect the liver. So probably Tylenol, acetaminophen, its generic name, is probably the safer thing to do. But again, use it obviously only if you need it.
Yeah, try to keep yourself as healthy as possible. Back to the phones. Caroline from Carl Place, you there?
Yes, I'm here.
What's your question tonight?
Well, first I'd like to say, Doctor, thank you for your services. And my question today is, can vaping lead to an underlying condition causing complications? And if so, are they asking the public to refrain from it or making the public aware of this factor?
That's a great question. Now, vaping, let's start with the person that's the vapor, the person that's inhaling, and smoking essentially. They're damaging their lungs, and this virus likes to attack the lungs, and that's where the major problems are. So that puts, I think, a person at increased risk. The second thing is, obviously, if they're in an environment where they're vaping in front of other people and they are infected with the virus, that's going to easily spread as well. So I think vaping is definitely not a good thing to be doing at this time.
And that would be true for smoking as well, right, Doctor?
Absolutely, same thing.
Okay. Margaret from Long Beach. Margaret, you there? Margaret?
I'm here.
Margaret, are you there?
Yes, I am.
Thanks for calling. What's your question tonight?
The question is, I had, when this whole thing started, bronchitis. I was coughing and all. A lot of stuff was coming up, and then it was yellow. So I asked the doctor for antibiotics. They gave it to me, and now the coughing stopped. But I'm still wondering, could that also have lowered my immune system with the antibiotics?
Well, antibiotics should obviously be used when we think it's appropriate and necessary, and obviously your doctor thought that. It doesn't really necessarily lower your immune system, but it doesn't also differentiate whether you had a virus at the time. What I really like, and I also am encouraging patients to do, I do this in my own practice all the time, when somebody comes in with what we call an upper respiratory infection, which could be sinus, it could be a cough, it could be a bronchitis. I like to do what's called a nasal swab. We were doing this before the coronavirus, where we swab and we find out, are they actually suffering from a virus, which there are like 15 common viruses that we can now test for and get the results within 24 hours, which include the influenza type A and B. So that's what I really strongly recommend any patient when possible. We're obviously in unusual conditions right now, but typically if I had a patient that called me up and said, Dr. Mitchell, I am, my throat hurts, my nose is congested, I'm coughing, can you prescribe me an antibiotic? I would say, I would prefer you to come in and get tested. So this way, if we know you have a virus, taking an antibiotic will not be beneficial. And this actually came up with a patient in my practice a few weeks ago before the whole coronavirus. I had a young patient came in, was actually severe sore throat, very fatigued, typically never missed a day of work, and came in and his parents wanted him to get an antibiotic. And I said, no, let's evaluate him. And I actually did the nasal swab, and within 24 hours, I found out he actually had influenza B, which fortunately I had started the Tamiflu, which is the antiviral medication, which helped ameliorate his condition. So that's why I think it's very important to be very specific based on the diagnosis.
Now, doctor, let me follow up on that. What about these drugs like hydroxychloroquine? We're hearing it's approved for other reasons, but they're looking at it potentially here. I know that some people kind of on the down low are taking it prophylactically. Should we be doing that? Is it
I don't think so. I think Dr. Fauci has made that point. I think that what patients and the public have to really understand, there are also different phases of this virus infection. And we don't know exactly when the hydroxychloroquine works best, if it works at all. But, I think that, again, if the public is taking vitamins, protecting their immune system, see how they're doing. If, God forbid, they get infected, within the first 5 days they see that their course is worsening, then I think it's possible the hydroxychloroquine could be a good addition, but it should be saved for those patients who are running into trouble. I think taking it prophylactically, we have no idea. Who knows? It may lower your resistance, because we know it can lower the white count. It may build up resistance to the medication. So there's a lot of issues that I think we have to be a lot more cautious in just people running to the drugstore and taking it prophylactically.
What about the new testings that's coming out? I know that they're starting to with the rapid tests. What's your opinion of those?
I think that's going to be a game changer. I like to give the public hope that I think this is going to be the most helpful thing for everyone returning to life in a new normal, in the sense that when we do testing, and it's called antibody testing, and it tells you whether you've been recently infected, like within 5 days, or whether you've had you're sort of recuperating, having had the infection possibly 2 weeks ago. And what I think this testing is going to be helpful for is that once we see people have what's called this blocking antibody, IgG, to the virus, we have a good sense that they are protected and will not get reinfected and will not infect other people.
Okay, Doctor, we're going to take a real quick break.
Sure.
Save that thought, and we're going to talk about it more on the other side of the break. We're going to have much more expert advice on how to keep you and your family safe from the coronavirus. Stick with us. Welcome back to our live coronavirus pandemic special report. Let's bring back in Dr. Dean Mitchell, clinical assistant professor at Touro College of Osteopathic Medicine, specializing in immunology, infectious diseases, and allergies. Before the break, we were talking about a lot of different testing and things that were going on. With the social distancing that's happening right now, not to this extreme, but is this something that we're going to kind of be the new normal, that we should just keep our distance a little bit?
Unfortunately, I think it is. I think it's going to take some time till the population as a whole is protected antibody-wise or through a vaccine. And I think it's going to really change the way we deal with being in areas where it's more densely populated. Yeah. And this is going to be an issue at schools. Classrooms, doctors' offices. I've already been actually taking steps to totally reformulate the way my waiting room is going to be, the way my offices. They're going to have certain instruments in it that will cleanse the air. So I think there's going to be changes that we'll get used to. I make the analogy, that flying on airlines was never the same after 9/11. I mean, going through scanners and taking off your shoes and waiting on long lines. But we got used to it and became the new normal. And I think that, again, in a lot of ways, there will be changes, but we'll adapt and we'll figure out the ways to do it, so that we can still enjoy our lives.
All right, let's go back to the phones. Frank from Glen Head. Frank?
Hello. I was wondering if a person has had the flu in the last 6 months, is he more or less susceptible to contract the coronavirus?
Good question. The viruses are separate. So if you were unfortunately infected with the flu and hopefully you recovered well, it doesn't mean you would be protected from being infected with this new coronavirus.
Okay, Suzanne from Seaford. Suzanne?
Hi. First, I want to thank Dr. Mitchell and you, Stone, for doing this show. it's so informative.
Thank
So
you.
my question is, I understand the hydroxychloroquine is used for overactive immune system to tamper the immune system down. On that same note, interferon is used to boost the immune system. Has interferon been looked at as a possible form of treating the patients that are in such a weakened state?
Doctor?
Yeah, that's a great question. I'm going to try to explain it as simply as I can because I think there's a lot of technicalities in everything. So what you said was correct. Hydroxychloroquine has been used for malaria, and they've been using these medications, chloroquine, I believe, as well for conditions like lupus and rheumatoid arthritis, which are inflammatory immune conditions. So essentially, they do lower your immune system, and I think they believe the way it works, though, is that somehow it inhibits the virus from replicating. So it's a little bit of a, good, bad situation with this medication. So I don't think it's the ideal drug by any means, but right now, again, it's one of the few that they think may be working. As far as the interferon gamma, I have not heard any studies with that. It's used for certain cancers. But what I'm very, very hopeful about, honestly, is the recovered plasma that they're going to get from recovered patients that have been infected with COVID-19. If you look throughout history, and I'm a kind of a fan of immunology history. I mean, back in the days of Louis Pasteur when he treated rabies, and back in the days where they treated smallpox. I mean, this is where immunology all evolved from. They took the serum from patients that had recovered from the illness and injected other patients. And those patients got lasting protection. So I know this is going on right now. I believe Mount Sinai is doing it here in New York City. Hopefully some other places will accept donations from people who have recovered. This could be huge because it could not only, it could help people at all different stages of the infection, and especially people even in the midst of severe illness. So hopefully that's going to work.
Okay, let's try to squeeze in one more question. James from Oyster Bay. James, you there?
Yes, sir.
What's your question?
Thank you, Doctor. I just wanted to know, my mother-in-law has been diagnosed 16 days ago. Is she still contagious? She's very ill still, at home in bed.
I would think that she is. We don't know exactly. I mean, I get a little concerned when they keep on saying, well, after 14 days or 2-3 weeks, you're not contagious more. We don't know that. I think the only way we know that is if at some point, hopefully when she's recovering, if she has one of the nasal swabs to see that she no longer has the virus in her nasal pharynx tissue. And hopefully with these antibody tests that are going to be available, we'll know that she's recovered. So I think she's got to wait it out a little bit longer and stay in isolation so she doesn't infect anyone else in your household.
All right, well, that unfortunately is about the time we have right now. Dr. Dean Mitchell, I hope you stay safe. Appreciate everything that you're doing. Thank you so much for coming on the show. I know you guys work long hours, and then you come on here and provide another public service for all of us, and we really appreciate it. So thank you so much. I'll give you a little elbow social media bump right there that will keep our social distance. And
I'll take it that way. Thanks, Stone. And everybody else stay safe out there.
All right, thank you very much. And you're watching our coronavirus pandemic special report. We thank you. We'll be back tomorrow at 7 o'clock with your questions. We'll get them answered live by the medical experts. We'll be right back.